So there's three things that will predispose you to addiction. The first one is having a strong genetic history or a strong family history. The second one is exposing your brain while developing. 98 to 99% of all addiction starts while your brain is developing. If you can postpone use until after your brain is done developing, you won't struggle with the disease of addiction. The third one is a history of childhood trauma, which I'm not going to go into detail today. Genetics accounts for 50% of all addiction. If you have a parent or a grandparent who struggles with addiction, you have about a 50% chance of developing addiction yourself. And I think sometimes the adults think I shouldn't tell you that information, but I disagree. I think when kids know what their genetic risk is, they can make better decisions. You don't get to change your genetics. You get what you get, right? You get what you get at birth. But if you can make the decision the right way about the next slide I'm about to tell you, you can almost entirely erase the genetic component. The genetics almost entirely go away if you can make the decision the right way on the next one, which is that all addiction is a developmental pediatric disease. It starts while your brain is developing. So when you talk to somebody who struggles with addiction, which is the work I do every day, I'm a family doctor who takes care of patients. I run a drug and alcohol treatment center. I'm the doctor at the local jail. I'm the doctor at my local school. Every day I take care of people who struggle with addiction. And when I ask them the question, how old were you when you first used cigarette or marijuana or alcohol? How old were you? What do you guys think the average age was? So I heard 15. I'm going to go lower. Yeah, the average age is 12, 13, or 14. The average age of first use was this room right here. This is the average age for people struggling with addiction. It was you guys, right? And my point is if that generation, this group of people could have postponed their use, particularly if you have a genetic risk, if you can postpone your use of your first use of alcohol, nicotine, or marijuana until after the age of 22, 23, or 24, you can almost entirely erase the genetics. That's amazing. You never get to erase your genetics on any disease, but with addiction you do. So if you're sitting here thinking about your own family history, right, and you don't need to share it with anybody, but I think it's worth having a conversation with your family about this, right? Like, I am coming back to Gloucester to do a talk that's a little bit bigger, but intended to talk to your parents on this subject. All I'm asking you guys to do is to delay your use as long as possible. Every year that you delay your use, you drop your addiction rates by 8%. Year after year after year. So this is the way you guys can protect your brains.